hand the session over to Christine, who is going to be leading the presentation. So I'm going to stop sharing my screen and I'm going to get Christine to share hers in a second.
Thanks, Kathleen. I can't turn my video on because it says the host has stopped it. That might be a setting you can change, and I can turn my video on. Okay. Can everyone see the slides? I think so. I think they're shared properly. So thanks everyone for being here today. My name is Christine Sheppard. I'm a postdoctoral fellow at Sunnybrook Research Institute, and I do a lot of research with older adults who live in the community and finding ways to address isolation and loneliness and connect seniors to social activities and engagement opportunities in the community that they find meaningful to them. So I'm really excited to be here today to talk to you guys about different strategies and opportunities that we have in the City of Toronto to help us manage our stress and anxiety that we may be feeling as a result of the pandemic. So I'm going to talk a little bit about what mental health has looked like for people in Canada with the pandemic and focus particularly on seniors. And then I'm going to talk about a survey that was just done with almost 10,000 seniors across Ontario, talking about some of the stress and anxiety that they're facing when they're thinking about rejoining some of their in-person recreation and social activities that they used to do regularly before the pandemic. And then I'm going to talk about different local initiatives that we can access in Toronto to help promote our mental wellness. As Kathleen said, I'm going to try a tool today called Mentimeter to help engage everyone in the audience during the presentation and get us to reflect on our own experiences with mental health and things that we have found to be helpful for us. And I'm actually going to start us off with a Menti, and I'm going to share the screen. Okay. So it's called a Mentimeter, and you have to go to the website menti.com. So you can access this on your phone or you can do it on your computer. And you go to www.menti.com, and you'll be prompted to enter a code, and the code is 8584399. And when you enter that code, you'll see this question pop up on your phone or on your browser, depending on what you're using. How has your mental health been since we started physical distancing? Is it worse than before? Is it about the same? Or is it better than before? I'll give everyone just a couple of minutes to navigate to menti.com. The code is 8584399. I see a couple of responses coming in. We have some people who say their mental health is a bit worse than before, some a bit better than before, but for a couple of us, it's about the same. Okay. Another person joined and said their mental health is a bit worse than it was before the pandemic. Okay. Back. Okay. So there's been a couple of surveys that have been done with Canadians that have asked people about how their mental health is and how they're feeling. And there was one done by the Angus Reid Institute back in the beginning of April that surveyed almost 2,000 Canadians and asked them what types of feelings are they having during this pandemic. Are you feeling worried? Are you feeling anxious? Are you feeling grateful, bored? And what came out was that almost half of Canadians were feeling worried, 40% were feeling anxious, but a third were feeling grateful for their health, grateful for their family, grateful that they were still able to access some of the important services that they needed to. Interestingly, about a third of people were feeling very bored. And I'm sure that's a feeling that we have all experienced over this pandemic as we've had to stay home and we've maybe not been able to participate in some of the normal activities that we had used to do before the pandemic. Statistics Canada also did a survey from the end of April to the middle of May, asking people how their mental health was. And they compared the data to how our mental health was in 2018 before the pandemic. So in this graph here, the dark blue lines are our mental health before the pandemic, and the light blue lines are our mental health during the pandemic. And what you can see here is that the proportion of people who had excellent or very good mental health is much lower in the pandemic than what it has been before the pandemic happened. And we see here that the proportion of people who say they have fair or poor mental health is much higher than what it has been before the pandemic happened. So people across Canada are experiencing challenges with their mental health, and it's maybe not as good as what it once was. And Stats Can actually ask that. They ask people, compared to, before the pandemic, how's your mental health? Is it a little bit better? Is it about the same? Is it a little bit worse? And we see almost half of people are saying that it is at least somewhat or much worse than what it was before the pandemic. Canadians are also experiencing some anxiety. 71% of people said that they felt nervous, that they felt anxious, or that they were on edge. 69% said that they were easily annoyed or irritable, and many of them were noting that they were having trouble relaxing. But something that really came out in this survey was that seniors were less likely to report moderate or severe anxiety. When they looked across all the different age groups, young adults, middle-aged adults, and older adults, they found that 41% of youth aged 15 to 25 had moderate or severe anxiety, compared to only 11% of seniors that reported moderate or severe anxiety. So compared to other age groups, seniors seem to be coping much better with the pandemic and the associated physical distancing that we've all had to do. The survey also showed that seniors' mental health is generally doing okay when they compared people who have had, or whose mental health has gotten worse over the pandemic versus people who have had no change, or their mental health is maybe a little bit better since the pandemic had started. They found that younger cohorts were more likely to report that their mental health was worse, whereas older cohorts were more likely to report that they had no change or better mental health. So 35% of people over the age of 65 said that their mental health was somewhat or much worse than before the pandemic, but 65% of seniors said their mental health is about the same, somewhat better, or much better than before the pandemic. So seniors seem to have lots of different coping strategies and opportunities to remain connected and promote really good mental wellness, even during the pandemic when schedules and lives have been disrupted. Now, I want to talk a little bit about reopening, and particularly focusing in on recreation and social activities. As Toronto moved into phase 3 of the reopening plan, lots of different community-based organizations started to open up services again. We have gyms that have opened up, some community facilities, restaurants are now open. So there's more opportunity for seniors to go out into the community and participate in different recreation programs, group programs, social activities, connect with our friends, etc. But we know that there are some sources of stress that people experience when they're trying to decide if they want to go out, if they feel safe doing these things, as well as different strategies that people have to feel more comfortable in these spaces. So I want to talk briefly about older adult centers. These are community-based organizations that provide recreation and social education and health programs that are tailored specifically to seniors. So it's like a community center, but all of the programming is specifically for older adults. And before the pandemic, many older adults all across Ontario, including Toronto, depended very strongly on these programs in order to stay active, to stay physically fit, to connect with others, and to create and experience a sense of belonging. But all of these in-person programs have been closed since the beginning of March, and they're just now starting to think about what it would look like if they were to reopen and offer these in-person programs again. There was a provincial organization called the Older Adult Centres Association of Ontario that did a province-wide survey of older adults who attended an older adult center. So there was 9,800 people who responded. And in the survey, they asked people, how comfortable do you feel returning to these in-person recreation and social programs? What types of things impact your comfort? And what safety measures do you want to see in place in order to feel the most comfortable going back to these programs? So before I tell you what the survey said, I want us to think about how comfortable we are returning to in-person programs and what types of things impact how comfortable we feel. So we're going to do a different Menti. Wrong Menti, just one second. Here. I'm just going to pull it up. Okay. Okay, I think that works now. Okay, so this one you're going to go to menti.com, and the code this time you're going to enter is 9107498. This is a two-part question. So first we're going to think about how comfortable we feel joining these in-person programs. And then we're going to think about what types of things make us feel comfortable or uncomfortable. So these in-person programs could be things like group card games. It could be a fitness class. Maybe you take a dance program like line dancing or ballroom dancing. Maybe you're part of a quilting club, a music group, a choir group. It could be really any type of in-person recreation and social activity, whether it's specifically for older people or not. How comfortable do you feel restarting these programs? Okay, we see here that a couple of people are feeling still pretty uncomfortable restarting these programs. And we have one person who is neutral. They could maybe go if it felt safe, or maybe they need to take extra precautions to feel most comfortable. Okay, so this is on the same Menti. I want us to think about what impacts your comfort level. You could think about maybe transportation, your access to things like masks, hand sanitizer. Maybe it could be you feel more comfortable in certain facilities versus other ones. So this is the same Menti presentation. The code is 9107498. So somebody has said being able to walk to these programs helps them feel more comfortable. Someone has mentioned that indoor versus outdoor programs impact how comfortable they feel. Maybe they feel a bit more comfortable doing outdoor programs versus indoor, and that's great in the summer, but that might be a bit more tricky once fall and winter comes. Someone has said that the number of people allowed in the room is really important. So you want programs that have smaller capacities, maybe than what you're used to. People concerned about how safe it is to actually be near people who are outside of the bubble that you have formed with your immediate friends and family. Someone else has mentioned everyone wearing a mask, but how do you enforce it? How do programs that you might be accessing make sure that everyone else there is wearing a mask? Someone talked about distance needed to travel to get there, right? So if it's really close and you can walk, or maybe you have a personal vehicle that you can drive, it's really easy for you to get there. But maybe if you have to take the subway, or if you have to take two buses in the subway, maybe you don't feel as comfortable getting there anymore. Someone else talked about whether you have to share equipment as part of this program, or if you can bring your own equipment, right? So if it's an exercise class, can you bring your own yoga mat, your own dumbbells, versus using equipment provided by the organization? Okay. Someone else said cleaning. So do you feel confident that the organization you're visiting is following proper cleaning procedures? Can you see them taking extra precautions? All of those types of things. Okay. I'm going to go back to my presentation. So I'm going to tell you now what these 9,800 older adults said in this survey, and we can see how maybe we're similar or different to some of the thoughts that they had. So 46% of the people who were surveyed felt comfortable or very comfortable returning to their older adult center for recreation and social programs. So about half felt comfortable going, and the other half said, no way, not comfortable, I'm not going to go. So we can see that we're pretty split. We have some people who are feeling very confident accessing these types of programs, and others are feeling like maybe it's too soon and maybe we need to wait a little bit longer. I want to talk about some of the worries that people had about resuming programs. It's very normal to feel a little bit of anxious, to feel a little anxiety about going out into the community and restarting these programs because you want to be safe and you don't want to get sick, but you are also maybe really feeling cooped up, and maybe you feel like you are really missing these programs. So you really, really want them to restart, but you just want to be able to do it safely. So one of the first worries that the people identified in the survey was that they were really concerned that not everyone was going to wear a mask or follow physical distancing guidelines. They were confident that the organizations they wanted to go to would have these rules in place, that everyone would wear a mask, that everybody would be physically distanced, but they weren't confident that other people going to the organization to participate in these programs were going to follow the same rules. People also talked about how they were really worried about having to wear a mask during certain activities. So fitness programs really came up, especially high intensity fitness activities, where wearing a mask might make it really difficult to breathe. And so they talked about how they were really excited to restart certain programs, but there were other programs like high intensity exercise where they didn't feel it was safe because they didn't think they could safely wear a mask while participating in it. People were very worried about bringing COVID home to a loved one, especially if they have someone in their home who is immunocompromised or who maybe is ill or is frail in certain ways. And so they didn't want to get other people sick. They didn't want to bring it home and share it with their bubble, which maybe includes grandchildren or adult children or very close friends. So people were concerned about going home and then, participating and contributing to the community spread of the virus, which they didn't want to do. People are also very worried about their own health when they had health problems. Maybe they had asthma, maybe they were a cancer survivor and their immune system is a bit more compromised. They were worried about their own health and felt that it was safer for their health to just stay home and not participate in these in-person programs. People were really not comfortable using public transit. People especially noted when they were comfortable, it was often because they could walk to the place in the community where the activity was happening, or they had a car that they could drive themselves, so they felt safe. But people who had to take public transit and who relied on things like the bus or the subway to get places felt very unsafe and felt it was too big of a risk to take for a couple of in-person programs. Similar to some of the ideas that you guys had, they did not want to share program equipment with other people and thought that it should be a requirement for people to bring their own equipment to programs, even if previously their organization had provided that program. Maybe it's art supplies, maybe it's exercise equipment. They didn't want to share it with other people. They thought that was too big of a risk. Some older adult centers and some program spaces that you might access might be shared with other populations. Maybe it's young children, maybe it's a daycare, maybe it's a youth program. And many older adults who access programs in these shared spaces, or maybe even intergenerational programs that were done in collaboration with these other age groups, they were no longer comfortable doing it. They did not feel that it was safe for older adults to be going into spaces that are shared widely with youth and children. Participants talked about some of the things that really eased their worries. So some of them said they're just not going to return to the center until there are no new community cases in their community or until there's a vaccine created. So some people have just decided that they will not feel comfortable going back out into these in-person programs until their community has no new cases or they have a vaccine available. Some people were very worried about what was going to happen this fall and thought it would just be best to stay home until the winter or the spring next year after our fall flu season passes and we see if we have a second wave emerge. People really talked about how they trusted the organizations they went to do a good job implementing physical distancing requirements and following disinfecting protocols and doing proper cleaning, but they really wanted to know about it. They wanted to be educated about what these spaces were doing to keep it clean, what the new rules were for members, and how frequently staff were cleaning things, and what new disinfecting policies were in place. They wanted to have that information and that knowledge from the organization. And as said before, people really felt more comfortable when they were able to walk or drive their own vehicle. So if you're bubbling with a really good friend of yours that does not have a personal vehicle or would typically rely on public transit, but you have a vehicle that you can drive, maybe picking them up and taking them with you and driving them to these spaces might make them feel more comfortable going out into the community. In this survey, participants identified what types of safety measures and PPE they would want to see happen at their center in order to really feel comfortable going back. Hand sanitizer was by far the most widely requested safety measure. They wanted hand sanitizer at multiple spaces in the center so that people could regularly sanitize and clean their hands. Many people, around 3/4, wanted all staff, volunteers, and participants to wear masks at all times. So they didn't want masks to be optional. Masks needed to be mandatory for people to feel comfortable going back out into community spaces to access recreation and social programs. About 2/3 wanted smaller class sizes, as well as daily screening when coming into the center, including temperature checks, as well as a checklist of other screening for signs and symptoms and risk factors. And just under half wanted to reduce the building capacity, so have fewer people in the community spaces so that we could maintain physical distancing. And they recommended things like having schedules where people sign up to say what times and days of the week they wanted to go and participate in programs so that these organizations could manage the flow of participants. So one of the most common questions that emerges, and I'm sure it's a question that you all have had as well, is how do you offer group programs while maintaining physical distancing? And I don't have an answer to that, but I know that community organizations that provide programs for older adults are working really hard to figure out what programs can we adapt to offer in person so that we can do it physically distanced, and what programs are simply just not going to work in the current environment. So some good examples is offering exercise classes at much smaller numbers where people are, 6 to 8 feet apart from everyone, so there's lots of space in the room. But other programs, maybe like games, board games, card games, when you have to be close to someone across the table from them, sharing cards, sharing game pieces, it's just not going to be possible to really do that in a safe way. So you might find that as you start to navigate and access in-person recreation and social programs, that they're not necessarily the exact same way you used to do it before, and that there might be some innovations, some new opportunities to learn new games to help offer in-person programs while still doing it while maintaining physical distancing. So now I want to move into different things that we can do to cope with stress and anxiety that we might be feeling. First, I want to talk about our breathing. Our breathing is really, really important. It's a great tool for us when we're feeling a little bit anxious. We can focus on our breath and we can help promote calmness and help control some of that anxiety that we're feeling. And I really like the box breathing. This is something that I find it's very easy to do. It's very easy to remember how to do it. And it doesn't require that much thinking to carry it through. So I really like it. It's when you inhale for 4 seconds, you hold that breath for 4 seconds, you have a slow exhale where you let that breath out over 4 seconds, and then you hold another 4 seconds before you take your next inhale or your next breath. So this is a really great way to just concentrate and focus on your breathing and feel the breath moving throughout your body, and it will help calm you down in times when you're feeling anxious or stressed in the environments that you're in. Breathing, there's lots of different breathing exercises that are available. And Dr. Richard Brown is a psychiatrist that really has focused on teaching people how to use their breath to help improve their mood, help manage their anxiety, to improve their sleep, to promote just overall health and wellness. And breathing is a really good way to do that. He has some YouTube videos of 4 different breathing exercises. So breath with movement, the hot breathing, 4-6-6-2 breathing, which is very similar to the box breathing, only they've adjusted how long you maybe hold the breath for, and then coherent breathing. And I thought for today, we could do one of these videos together. They're very short. I thought we'd do the ha breathing. I find it to be the most fun. It's a little bit silly, but you feel really relaxed and good after it. So I'm going to share my screen that has the video on it. Okay, so I'm going to make it big. All right, so you're gonna need to have enough room in front of you that you can throw your arms out directly straight in front of you. It's a short 2-minute video that we'll work through, and I encourage you to engage and get involved with it at home.
So let's do a little bit of what we call hot breath. So we're going to do it this way. We're going to breathe in, bringing the arms back, the elbows back, and then we're going to go, ha, kind of shooting the energy out, almost like you're throwing energy off your fingers. And yell ha as if you're 5 years old, you're on the playground, and no adult can tell you to be quiet. It helps to get stress out, and it can actually make it easier to do the coherent breathing that we're going to be doing. So breathing in, ha, 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 ha. 2 more. Ha, ha. Now relax. Rest your hands. Close your eyes if possible. Feel where the energy is moving most strongly in your body. Observe the sensations through your whole body. Observe your thoughts and the quality of your attention, and what rhythm your breath wants to be in. So you may find that your attention is more switched on, which means you can use this to prepare to study, to do writing, to do an athletic competition. And notice how also your breathing slows down after this ha breath compared to where it was before. So there's this immediate activating effect of it, and then you begin to calm down more afterward.
Okay. I hope everyone enjoyed that. I made the arm movements. I didn't make the ha noise because I didn't want to make it so you couldn't hear the video. But he has other videos, and I really encourage you to go and check them out and find out if there's a particular breathing tool or technique that really resonates with you that helps you feel more connected, more grounded, and less anxious or less stressed. One of the best ways we can help manage our stress is to deal with the things that we have control over. So in the context of the pandemic that we're all experiencing, we can arm ourselves with knowledge about the COVID-19 symptoms, about different risk factors, and about protective factors, and how to keep ourselves safe. We can teach ourselves how to properly use PPE so that we feel safe and confident using those protective measures. When we go into community spaces, we can be aware and we can learn and ask questions about what safety policies they have implemented in that space in order to protect people that go into that space. What types of cleaning policies have they implemented? What types of screening policies have they rolled out? And you can share your voice. If there's programs that you want to restart and you need certain things in place to feel more comfortable, you should tell those programs what types of things you're looking for from them and from their organization so that you can feel safe returning and participating in those programs. They do want to hear from you. People do want to know and understand about what will make you feel safe and confident. That's not to say they can always meet those requirements, but it gives them an opportunity to understand what your needs are so that you can feel confident and comfortable, and hopefully they're able to adapt their program space so that you are able to go there safely. Another really important thing that we have control over is knowing where to get help. When we are feeling more alone, when we're feeling very stressed, when we're feeling isolated, do we know where we can go to talk to someone, to access programs and services? Now, sometimes there are things that we can't control, but there are things that we can do to feel better about those things we can't control. Getting some exercise is so important. It's so important to get outside, to get moving, to exercise, whether you do that in your house, to an exercise video, to a YouTube video, to a live Zoom class. Getting some exercise is really important. Staying connected to your friends and family is also very important, whether that's through the phone or through Zoom conversations, or bubbling with your family and your grandchildren or your children or your close friends. Stay connected to your friends and family can really help you feel less stressed about some of the things that we can't control. What's so important is to seek help when you need it. Everyone is going through a lot of different types of stress with this pandemic. And sometimes we need to talk to someone, and sometimes we need a little bit of help. So knowing when you need help and knowing where to seek that help can really help ease our anxiety and make us feel more control and more comfortable and confident. Now, I want us to think, before I talk about some of the programs and resources that are in the City of Toronto that can help us stay connected and offer us help when we need it, I want us to think about some of the things that we are already doing in our life to feel confident and to manage our mental health. I'm just going to pull up another Menti. Okay. So I'm going to share this screen right here. Okay, so this is our final Menti of the day. What have you been doing to promote your mental health? What are things that you have done in your life to manage your anxiety, to manage your stress, to feel confident navigating your programs and services that you normally do? Go to menti.com, and the code is 6873986. So we have a couple of people who are dog people in the group who want to spend time with their dog or do training with their dog. And we have people talking about things they're doing outside. So social distancing with their friends outside, sitting on their balcony, going for walks, maybe in the park or around your neighborhood. Journaling, that's a fantastic opportunity to promote your mental wellness. Some people like to do what's called gratitude journaling, where you talk about things in your life that you're grateful for, as opposed to dwelling on things that are causing you stress or anxiety. Someone also talked about learning new skills. So learning how to use Zoom and how to navigate Zoom programs is a great thing to do in a pandemic and you're mostly limited to your house. Someone else talked about how they also are doing online programs to promote their mental wellness. Okay. Thank you, everyone, for sharing some of the things that you do. I'm going to go through some of the resources that we have available to us in Toronto to help promote our mental wellness. The first one that I want to talk about is more to help promote really good mental health in times where we're really struggling and we need someone to talk to. So the first one I want to highlight is the Student Senior Isolation Prevention Partnership. I really love this initiative because it's led by students at the University of Toronto. Students who are in programs where they're being trained to become health professionals like doctors, social workers, nurses, occupational therapists. These students have volunteered to create this isolation prevention partnership where healthcare professionals refer seniors to the program. And through the program, seniors can access social comfort and connection through friendly visiting telephone calls. They can learn how to use some of the different technologies that we have available to us through technology training. This program will arm older adults with knowledge that they need to build health literacy on COVID-19, the signs and symptoms, ways to keep safe, how to use PPE, so that type of knowledge building and capacity building. They can also help refer and connect you to community resources that might also be valuable to you. So it's a really great tool, if not for you, then perhaps for someone that you know who is maybe struggling and really needs to connect with someone, or needs to learn how to use the technology, or needs some new education and training on and health literacy on COVID-19. To access this service, you do need a referral from someone who is in your circle of care. So that could be a social worker, it could be a doctor, it could be a nurse practitioner. There's not one referral source they take, but you do have to have a referral from a medical professional that you're working with in order to connect with this program. But maybe you just need to talk and you don't want a referral, you don't want to go to your doctor, you don't want to deal with all of that. You can also talk to NICE, which is a community outreach program through the National Initiative for Care of the Elderly. They have a toll-free phone number, it's Canada-wide. You can call and talk to them. They offer free over-the-phone outreach services for older adults and persons with disabilities. They are a team of social workers and social work students who are there to support you. And if you don't maybe need to use this line, but you think a friend or someone else in your network would benefit from having someone to talk to, you can make a referral for them. You can let Talk to NICE know, and they will call that person on your behalf, and they'll use friendly conversation to see if they're interested in engaging and connecting. So if you know someone who might benefit, this might be a program where you could share or make a referral for them. The City of Toronto has this really cool website called Stay, Play, and Learn at Home. And they are connecting with different community groups all across Toronto to learn more about what opportunities they have through their programming for people to stay and learn, or play and learn, while staying at home. So they have a bunch of programs where they have listed, the target audience. Sometimes the target audience is for children. Sometimes the target audience is the general public, for everyone. But other times there are programs where they've identified specifically for older adults. So the link here is at the bottom, and Kathleen can share this with everyone. But if you use the search function and search for older adults, you'll find programs that are specifically for older people in Toronto. But also there's just lots of really cool other programs that are available just for anyone in the community. A really good example, if you're an artist, is the Art Ignite workshops, where they're offering mentorship from professional artists for those who want to create, experiment, or exchange ideas while playing and learning at home. So this website is updated very regularly to make sure that the information remains current, especially as new programs are emerging the longer we stay in social isolation and physical distancing from people. So I definitely recommend checking it out. Sort by older adults, but also check out the programs that are for everyone. You might find a new skill that you might be able to learn, or pick up an old interest or talent or skill you had that maybe is a bit rusty that you haven't used in a while. I also want to talk about Senior Center Without Walls. I really wanted to talk about this program because not everyone feels comfortable using Zoom. Not everyone has the internet. Not everyone has a computer or a laptop or a tablet that would allow you to access online programs like Zoom. And so I wanted to flag Senior Center Without Walls because this is recreation and social programming that is facilitated through your telephone instead of through the computer. So the Senior Center Without Walls is for any older adult or senior over the age of 50. And it's a diverse group of people who connect by telephone for free for group activities that are both informative and interactive. Anywhere you have a phone, you're able to access it. All of the Senior Center Without Wall programs have toll-free phone numbers. And the sessions range from 30 minutes to 60 minutes, and they're offered regularly throughout the week. Usually a Senior Center Without Walls program will typically offer 1 to 2 programs a day. And the goal of these programs are to offer inclusive, safe, inviting spaces for people to listen, learn, and be heard, and to increase social connectedness and well-being among the people who are participating. Senior Center Without Wall programs, they've been around for a while. There's been one in Ottawa from the Good Companion Center for a couple of years now, but they've really, really skyrocketed in popularity with the onset of the pandemic as everybody pivoted from in-person programs to virtual and telephone-based programs. And the Older Adult Center Association of Ontario did a little survey, a brief survey of 1,330 older adults from 31 different Senior Center Without Wall programs to ask them, how did this help you? How did this program or these telephone-based programs help you during the pandemic? And 70% of seniors who use these programs said they felt a lot less isolated since joining these telephone-based programs, and 26% said they felt somewhat less isolated. So this is a really great program opportunity to engage, to connect, to feel less isolated, to form new relationships, maybe with new people that you didn't have before. And it's great even if you are a very internet savvy person. I know for myself, sometimes I can't sit in front of the computer anymore. My eyes hurt. I'm tired of sitting. I need to have a different, change of pace and do something different. So telephone-based programs are maybe a great opportunity to still have that connection and that stimulation and that engagement while maybe not being stuck in front of a computer. They offer all kinds of programs: general discussions, educational lectures, health and wellness seminars, live music, things like trivia, book club, storytelling, all kinds of activities. On the left-hand side here, this is an example of a Senior Center Without Wall program that's from the North York Senior Center in Toronto. And as you can see, the programs are typically offered early afternoons over the telephone, and they have a wide variety of things Monday to Friday. Usually, like I said, only 1 to 2 programs a day. But these programs are completely free. You do not have to pay to participate in the program. You don't have to pay to be a member of the center that's hosting this program, so they're totally and completely free. Now, where to find a Senior Center Without Wall program, you might ask? Well, there are 13 of them in Toronto, so you can see the 13 dots on the Toronto map here. And I got this map from the Older Adult Centre Association of Ontario website, where they host a page where they've gone through and highlighted all of the different centers that have a Senior Center Without Walls program, where you can click on that center and be navigated to their website or the phone number to call and access the information on when their telephone programs are and how to access them. You don't have to live in a particular catchment area to access these programs. You can literally find the program that interests you most. Maybe you want to do trivia every day of the week, so you can go from program to program to program, accessing different telephone-based trivia programs. I also wanted to flag the bright spot where older adults shine, which is through the YMCA. This is virtual-based programs, so through things like Zoom and Microsoft Teams. They have a really, really extensive calendar that includes exercise programs, skill-based programs, just more social connection and conversation-based programs. This is a screenshot that I took of the website just the other day, so it's pretty current, I think. Things like, for example, Monday at 11, they have balance programs. Thursday at 1, they have a book club. Thursday at 7 p.m., they have culinary club. So lots of different activities that are facilitated through Zoom that can teach you new skills, maybe meet new people, or play a game. They have bingo, language classes, different exercise classes, all kinds of things. The Y Fitness virtual workout videos through the YMCA are also something I wanted to flag, because I think being active is really, really important during the pandemic. And anything that we can do, I know working out at home is really hard to get motivated, hard to find a good program that you like. So I like to give different opportunities of where you might find a program. They have lots of different fitness programs for different fitness levels and intensity and type of fitness that you want to do. Maybe you want to do cardio versus strength versus yoga or Pilates. They also have a gentle fit set of videos where you can do seated or low impact sessions, seated yoga, chair yoga, standing options, all kinds of things here for different workout levels. These videos are all archived on YouTube, so they're not live. So that means you can access them anytime, as long as you are able to access YouTube through your phone, like a cell phone, or through a laptop or a tablet or another computer. And you can find a couple of videos that you really like, and you can do that over and over again, or you can try different videos every time and see how you do. And that was it for all of the resources that I had to share with you today. I hope that you found something among the list of resources that might be helpful to you, or that you learned of a new resource that you didn't know of before. And that's it for me. Thank you.
Thank you so much. So I do see that there's someone with their hand raised. Oz, I'm going to unmute you so you can ask a question. Oh, and you're muted on your end. I think you're muted on your end. Oh, Brenda, your hand's up.
Hi, can you hear me?
Yes, I can hear you.
Hi, I've been isolating since March. And the thing is that I feel the same way that the day camp had incidents is the same way that I feel that the community center I go to will have incidents. And since I have MS, I feel that it's way too dangerous for a 68-year-old woman to go out.
Yeah, I hear you, Brenda. I think that's a really common sentiment and fear that people have, that it's just not safe. Especially like yourself, if you have a health condition that you really need to protect and take care of, right? You have to take good care of yourself. And we might see when community centers like older adult centers open up, we might see similar things that we saw in daycares might happen. But I know that staff at older adult centers, for example, are working really hard to figure out, is it safe to resume programs? That's the key question. Is it safe to resume in-person programs? And if so, what in-person programs is it safe to resume, and how can we do that? And if you don't feel comfortable going to in-person programs, then you should not go to in-person programs. You should only do what you feel comfortable and confident doing, where you don't feel stress and anxiety. So hopefully some of the other programs that I talked about, the Senior Center Without Walls, over the telephone, or maybe Zoom-based programs, might be something that could be a good alternative for you, so that even though you're isolating at home, you can still feel connected to other people. You can still engage with other people who maybe aren't in your immediate bubble, and maybe learn a new skill.
Learning a new skill?
Yeah, absolutely.
Well, the thing is that I find that even doing two physio classes for an hour, like twice a week, if it's hot, I can't go outside. And this summer has been the worst. So I haven't been, I've gone out 2 days this week because it dipped, but
Mm-hmm.
now it's so hot.
It is. It's super hot outside. And I have dogs, and we don't go outside from like 11 until like after dinner, because it's way too hot outside.
Well, I have a cat.
Well, I hear you though. It's too hot. And so if you do want to get outside, then you definitely have to think about doing it in the morning or in the evening. But maybe there's some online classes that you would enjoy, like a book club that could be done on the telephone or through Zoom. I'm just going to go back on my screen here. The Bright Spot, where older adults shine through the YMCA, has lots of different kinds of programs. They have fitness things that you can do at home, indoors, but they also have other things like culinary club, where you can maybe learn some new cooking skills. They have book club. They have language classes, if you want to try to pick up any language or practice the language you already know.
Are those free?
I believe they are free, yes. I believe they are. I would have to check, and I could send the information to Kathleen, and I could circulate that information out.
Yeah, because it's if I didn't have my cat, I think I would have gone nuts, because
I hear you. You might also want to try. I can send out the list of the 13 Senior Center Without Wall programs in Toronto. I can circulate the list so you don't have to navigate to the map. And I can circulate the contact information on the website. But there's all kinds of programs that you can do over the phone as well. I'm not saying that they're exactly the same as in-person programs, but when you don't feel comfortable going out and it's not safe for you to be out in the community, then these are alternative options that we have to feel connected, to engage, to help fill our time during the day. And these programs are totally, completely free. All you need is a telephone.
Well, I'm not uncomfortable using Zoom or something.
So then you might prefer the online program. So the Bright Spot is a really good spot to start. They have a pretty extensive and impressive calendar. Older adult centers also have online programs that they facilitate through Zoom. Again, you'd have to kind of go center to center to see which organizations are offering which types of Zoom programs. But that's certainly another option that you could take a look at. The OACAO website has a list of all of the older adult centers in Toronto. So that could be a good spot for you to start figuring out what organizations are offering cool Zoom programs that are of interest to you. And again, I can circulate some links through Kathleen to share out with everyone.
Awesome. So there's options. I know if you're calling in, I'll unmute you and you can ask a question if you want to ask a question. If you're using a computer, the other options you have are that you can either type in the chat box or you can type in the Q&A box. It's whatever is more comfortable for you. Don't be shy. And you might be muted on your end as well. So I will unmute you and then you'll need to unmute yourselves on your end. So if you're on the computer, it will be a button that looks like a microphone. If you're on the phone, I believe it might be *6 that you push to unmute yourself. Everybody's such a quiet group. Those are really good questions that you've asked so far. So I guess if there's nothing else that anyone wants to ask, thank you so much for taking the time, Christine, to give us this really informative session. Hopefully, yes, would I send the video of the webinar? Yes, absolutely. What we'll do is we will post something on the TCA social media to let you know where you can go to find the video of their webinar. And you can also send us an email. I'll post the email if you have any specific questions or resources. And like I said, I will also be following up through SurveyMonkey or through Eventbrite with a follow-up survey because we do want to get your feedback on our webinars, and I will also be sharing the resources that Christine said she'd pass along. So thank you so much for joining us. This is the second in our webinar series. We're going to be having quite a few more coming up over the fall, so just stay tuned and stay posted. And thank you so much for joining us today.
Thanks, everyone. I hope you have a great day.
Bye, everybody.